Hello, everyone. I hope you can all hear me. Okay, thank you. My name is Evelyn Tugiri. I am the local officer standing committee for medical education and research, Egerton University. Welcome to today's webinar on gender-based violence by Professor Mathai Muthoni. I will allow Diana Mwanzia to introduce her. She's the local officer, University of Nairobi, SCOMER. Please, Diana, can you go ahead, please?
Hello, everyone. I hope you can all hear me. Welcome to today's session. My name is Diana Mwanzia, as you've heard. For those of you just joining us, welcome. I'd like to introduce the speaker for this session today. Some of us have been lucky to be her students at one point in our training. She is a senior lecturer at the Department of Psychiatry in the University of Nairobi. She has been a board-certified doctor for 37 years. 30 of which she has practiced psychiatry. I am talking about Professor Muthoni Mathai. We have to appreciate that among many of her skills is gender-based sexual violence management, and she has been an active member of the Gender-Based Violence Stakeholders Working Group and the Technical Group on Gender and Reproductive Rights. She has presented on this topic before on various occasions, including the third and the fourth regional psychotrauma conferences, the Eastern African Young Psychiatrists and Trainees Association, among many others. Professor Mathai, thank you for getting time to speak to us today. I officially welcome you to this session, and I hope you all learn something from it. Karibu Daktari.
Thank you, Diana. Myself. Oh, am I visible even? I thought I'd showed myself. Anyway, it's okay. Let me say good evening again for those who had not come when I said good evening. It's a real pleasure to be invited. Why is Chagari Jones laughing so hard? There's a guy lying on a sofa laughing really hard. What? I did not understand why he was laughing, but it's nice. I'm glad you're so happy. I will try and make this not so long so that we can have time for some discussions. This is really a very important topic. It's also one of the topics that I teach in medical school to undergraduates and to clinical psychologists, where I have a module, and a module that we call psychosexual disorders. And so I will just put my presentation on, and then I hope it works well this time. Doesn't always work, huh? Okay, present. Oh, okay. Let's see. It's one of those days. That might be a big disaster if it doesn't work. I hate this. Oh, wait a minute. Gender-based violence. Is my video on? Can you see me? You can, huh? Wendy, can you see me?
Yeah, we can see you.
Okay. Because somebody told me that sometimes if you don't have your video on, it doesn't work. Or maybe another reason could be that when you have multiple windows open, so let me open all of them. I'll regret it later, but I'll get them from the history. I have like 50 open, so that might be a problem. Too many things happening in... Okay, I've reduced them. So let's see whether I can present now. No, not showing on my screen. Okay, let me try and... Oh, I hate this technology. Let me try by using my entire screen. Does it help? No, doesn't help very much because I still can't find my presentation. Okay, let me put it on and then get back. Is there somebody I can send it to? We see whether they'll manage, because I can't manage. Oh, it's here. I found it. Whew, that was good. That was close. Almost didn't work. Now, I want somebody to tell me whether they can see my slides, because I'm not able to see myself. Can you see my slides, somebody who is not muted?
Yes, we can see.
Thank you. If they disappear, and if I disappear at any time, because I won't know I have disappeared, that is my network backfires or something, please call me. I have my phone here next to me so that I will know that I'm no longer in this session. So you requested me, hey, that is a nice spelling here, Pooh. Don't worry about it. You requested me to do gender-based violence, domestic violence, and toxic relationships with misspelling there. That's my fault. So gender-based violence, sexual violence has been one of the topics that I've been very engaged in, maybe less now than I used to be, not in so many working groups, but and this used to be one of the, this picture used to be in dustbins in Nairobi all over about 10, maybe 10 years ago. It seems to have disappeared in the meantime. In fact, the activities around gender-based violence have gone down. We don't have as many as we used to have. They're still there, but they're not getting enough attention as they used to now. Let's look at the definition. And when we talk about gender-based violence, what are we talking about? Because this is just one of the many terms that you're going to hear about. Like you see, the other one was violence against women. This is gender-based violence. Gender, we say, is a term that is used as it's a social construct, which is used to refer to masculinities and femininities. It is not the same as sex in terms of biological sex. It is not the same as male and female. Male, female, XX, XY, those biological sex. You may have any of those and still be a different gender. So we say it is a social construction. It is the identity that society gives to you, whatever, and culture your society gives to you when you're born and declared male or female. That means it may not always correspond to actually the biology, because sometimes people make mistakes because of some of those ambiguous genitalia or anatomy. So gender is a social and cultural construct. And gender-based violence refer to different forms of violence perpetrated against the individual because of their gender, meaning because of that which society, are you feminine, masculine, depending on your society, what are your roles, what do they expect from you, what do they expect you to look like, to behave, to engage in, interact in, depending on your gender. So the different types of gender-based violence include physical violence, emotional violence, sexual violence, cultural violence like female genital cutting, forced marriages, domestic violence, that is violence within the home, and what we call intimate partner violence, which is violence when two people are in an intimate relationship, whether they are married, this could be married, boyfriend, girlfriend, whatever, engaged or whatever. Now, some of the factors associated with the gender-based violence, acts of violence is, in most cultures, the perpetrators are men, and the females are the called survivors when they survive, or victims when they don't. And this is a violence that is acted against women because their female gender. Part of the reasons are that biologically females have weaker physical strength. They have usually in many cultures, and this is very true in our setting, low status in society. They lack resources that men have access to. They're usually dependent, sometimes either dependency to parents and for a long time, and then to husbands or whatever. And then there are also the sociocultural norms that say that it is okay, some cultures where they say it is okay to discipline women like children, or it is okay to put them in a position of subservience. So, like I said, most of the perpetrators under the circumstances are male. Now, intimate partner violence refers to any behavior within an intimate relationship. That one I have already mentioned, which causes physical, psychological, emotional, or sexual harm. Now, these are some of the examples of types of behaviors that have been identified within the context of gender-based violence. Physical violence, such as slapping, hitting, kicking, beating. Sexual violence, including forced sexual intercourse and other forms of sexual coercion. We see some of these in the sexual offense. Emotional or sometimes psychological violence, which is abuse, such as insulting, belittling somebody, humiliating, intimidating, destroying things, threats of harm, threats to take away children, threats to kick, to put somebody out of the house. And then you also have under psychological controlling behaviors, when isolating a person from the family, friends, monitoring their visit, restricting their access to many things like financial resources, employment, education, and even medical care. Domestic violence is another term that you will hear a lot, and this is used interchangeably sometimes with gender-based violence or interpersonal violence. But it's important to notice that when we talk about domestic violence, we also include violence against the children in that home. This is violence within the home, and elderly people in a home who also sometimes undergo a lot of violence from the younger generation. And then you hear a term called battering, which is the escalating physical violence from partner, often with multiple forms of violence and the physical injuries, sometimes fatal. Now, a little bit about the statistics in our setting. In 2014, the Kenya Demographic Health Survey and Household Survey did an extensive survey on gender-based violence, and they have not repeated that, so we still see a lot about 2014. But they found that 47% of the women and 40% of men between ages 15 and 49 reported that they have experienced either physical or sexual violence. Tells you that violence, physical violence, is very common in our setting. And so it is to be suspected that the 49%, the 40% of these men were somehow involved in some form of physical violence. Of course, even men experience sexual violence. As you will see, the 44% of the men are involved in physical violence, meaning that about 5% are the ones who are involved in a sexual violence. It also tells you that violence in our society is quite high. This, of course, did not say whether it was intimate or whether it was also in the public sector, where we know there's a lot of violence. Now, let's look at violence against women in Kenya, because violence against women is actually more common than violence against men, particularly sexual violence. Now, I think the same study found that the lifetime physical and sexual violence, 40.7% in the intimate relationship. This is not just anywhere. This is among people who are committed and are partnered, have been partnered at one point or the other. And this is lifetime. That means has ever been involved, that means. And then in the last 12 months, it was 25.5%. Now, child marriages, that is in women among between the age of 24 was found, 20 to 24, was found to be 22.9%. That means these are people who had been married or been in a union before the age of 18, which is the legal age of marriage in our society. And then in the 2018, the female genital cutting in the age group was 21%. Now, some other recent studies have said that this is something from 2018, that 32% of young women aged 18 to 24 and 18% of their male counterparts have experienced some form of sexual violence before the age of 18. Now, gender-based violence is that kind of violence that reduces the power to negotiate for safer sex, and that is why it has also been very instrumental in the spread of HIV. It has also had a big impact on the capacity of young women to remain in school, as you may probably know, that one of the biggest risk factors of a girl not completing her education is pregnancy. And a lot of pregnancies in young girls occur within the context of violence or coercion. Now, the actual prevalence of sexual violence and rape is difficult to assess even in our country because of underreporting, that most forms of sexual violence that are reported are those that occur with a stranger, rape cases by strangers. And even these are highly underreported. It's not unusual for a girl and a woman to get raped and then creep back into herself and her house and hide, and because of the stigma associated with rape and sexual violence. Other forms of violence, like intimate partner sexual violence, date rapes, which are also intimate partner violence, are hardly ever reported. So, but it has been estimated that globally, that out of every 10 women born in a country, 4 will be raped during their lifetime. That is a very risky and scary figure. Now, between December 30th, this is, I think, the last time the crime scene did a good report. So you will excuse me for these outdated figures, but I found that they were the best, that more credible. They found that within 1 year, the estimated statistics of rape and pedophilia, that is rape of a minor or sex with a minor, which is a child abuse, was 40,500. Now, they also reported that this is highly underreported and could be 3 times as high as that if all reports were coming in, because it is estimated that only 1 out of 20 women in Kenya will report a rape, and only 1 in 6 will seek medical assistance. And things may have changed a bit better, particularly with the Sexual Offences Act. and also with the more increasing access to care for survivors of rape. The same study looked at the age groups, and they said that most of the victims, most, not all of them, were women from the age of 9 months to 105 years of age. Scary. And they're more likely to have been reports of sexual violence or rape from a stranger, 60%, which means that a lot of sexual violence taking place in the home is not being reported. There were also likely to be more reports of multiple perpetrators. The threat of physical injury using knives or gun or at gunpoint was common, and almost half occurred inside the homes of the victims. That means that the home was violated by, a lot of times, by a stranger, robberies, whatever. Now, the timings, I found that interesting. Saturdays between 7 and 1 was particularly common time for all reported cases. I didn't think about that, but this is the time when there's a lot of movement, before COVID, that is, outside in the pubs, in the clubs, and when a lot of people are inebriated. Now, the Sexual Offences Act of 2006, this is a very important act. I can't go into the whole of it. It's a very extensive document. I would suggest you go and read, particularly, and read also what are the consequences of some of these acts. I'll just run through them. That include, the first one is rape. These are criminal offenses: attempted rape, sexual assault, induced indecent acts, which include contact with private use of objects, bestiality. Oops. And there are several others, including, I don't know what, I think I lost one slide, but there are several others which include pornography, it includes sexual incest, sex with a minor, which is called defilement. It also includes pornography. It includes sex trafficking of minors and people with who mentally with mental incapacitations and so on. So there are several. There are about 10 or 12. I don't know where I lost one slide, the continuing one, but basically that is. I suggest you go and read it yourself. I'll look for that slide. Now, among the many forms of sexual violence that have been described, and this is important for us because we've had issues, a very, very high rate of rape. I think reported up was over 1,500 cases during the post-election violence. Is sexual violence in armed conflicts or in conflict, which has been called by somebody the darkest legacies of 20th century, that you can never find an armed conflict where rape is not occurring, and the most of the victims are women, girls, children, boy children, and what they call feminized males. That is, men who are not fighting, who are at home. So, and this kind of atrocity have become a part of, so that it's like a weapon of another form of warfare is rape and atrocity against women's bodies particularly. And there are very many horror stories. You know about this girls, bring back our girls story. Most of these girls were never recovered. A lot of them have been indoctrinated into the fundamentalists. They have been married off. They are minors. They got pregnant. They got children. They are now wives in captivities. And this is what happens when one group of people decides to punish a community by stealing their women. And it's so archaic that you wouldn't think it would still be happening, but still happens. There's several others: violent abortion of fetuses, forced pregnancy, deliberate infections, and even forced incest. Now, very important in our college communities and among young people, like the ones we have in our colleges, is what has been termed rape dates. Now, rape dates are rape during a prearranged date, but not always a date as we know it, but with somebody you meet out. It can be with somebody you meet out, like you go out with your friends, and then you meet some people, maybe you didn't even know them, some friends introduce them, and somehow you end up with them, okay? It can also be that it is you go out and then you meet somebody you've known but not very well. So it is not always like he called me for a date. It can also be a date that happens, but it is there's some kind of a relationship, even if that relationship is not an intimate relationship. It could be just acquaintance, could be some form of friendship. Common features of rape dates are alcohol and drugs, and I really want you to note this. Substances that make these are substances that make it easier for someone to perpetrate rape or sexually assault another person. And it, on the other hand, it is also makes the victim easier to assault because they become confused. They have trouble defending themselves. Sometimes they become unconscious, and very, very tricky. Sometimes they may not remember what happened because they have been dragged. Now, some of the commonly used ones, apart from alcohol and apart from all others, cannabis and cocaine and heroin and all those other drugs, is the prescription drugs. Common drugs include prescription drugs like the GHB, gamma hydroxybutyric acid, which has become popular not here but maybe in the state. Rohypnol is it's called the rape drug sometimes. Is a benzodiazepine, ketamine also as a liquid. And usually these are selected because they don't have a particular taste or smell. And so they are easily mixed into whatever you're drinking. And the drink is usually alcohol. Now, the drink can also be a soda. And this is where I always say, and if you sometimes, I don't remember whether I said this, when we are doing when the first years come and we have all those lectures, I can't remember what they are called, then one of the things they say is that it's so important that when you get out of your home and now you're out in this big city or whichever city you are in college, you're independent for the first time, you go out, be your brothers and your sisters' keepers. Girls, don't go out on your own with people you don't know very, very well. And if you go out, look out for each other. If you know that your friend has a weakness for drink, take care of her. Don't leave her. If you have to carry her on your shoulder and drag her home, if she looks like she's not coming, take her. Let her hate you tomorrow, but she won't. So you need to take care of each other and to protect each other. Make sure that whenever people are on the dance floor, there's somebody who is taking care of their drinks. These are small things which can make a lot of difference. College women and such, we don't have a lot of data on rape dates or even rape in our colleges. maybe somebody should do that and look out for this. But some people have done studies in the US, a lot of studies indeed, and some of these I pulled out of that, and they say that women ages 18 to 24 are at an elevated risk of sexual violence compared to all women. This is a very vulnerable group, and I don't think that has changed much in our society when it comes to sexual violence. The other is that women in college are 3 times more likely than all women, but women not in college are 4 times as much. Okay. College sexual violence and alcohol, I just mentioned this, and some of the findings were that 20 to 25% of women will be sexually assaulted in college. More than 12% of completed rapes and 35% attempted rapes are date rapes or are dates. At least 50% of student sexual assaults involve alcohol. And about 43% of sexual assault events involve alcohol used by the victim. 69% involve alcohol used by the perpetrator. Take these figures and think about it, and remember what I just said, that when you go out on your dates, there are some things you need to think about, and there is need to watch out for each other. Now, the rape of women is not really about sexual pleasure. Let somebody not tell you that it's about pleasure. It is about the exercise of power. It's about control. And like we said, there are some reasons why women get raped is because of the physical strength, status, resources, dependence, and so on. Now, this is where the thing went with the Sexual Offences Act. Okay, let's skip that and go to the psychological effects which are associated with sexual abuse. These include anxiety, and most particularly acute stress disorder and PTSD. The commonest, the kind of trauma most likely to cause PTSD, at least 50% or more than 40% of the time, is rape. PTSD is post-traumatic stress disorder, in case you're wondering. There are other disorders in psychiatry, somatoform dissociative, depression, substance abuse, and even provoking the onset of a psychotic disorder or a relapse. Now, some of the psychological sequelae that we find, and these are particularly common with children, but also with young people, is the loss of ability to trust, depression, again, anger, guilt. A lot of people who are sexually abused suffer from guilt, thinking, I could have done something. Maybe I should not have drunk. Maybe I should not have worn that dress. Maybe. But please, women have been raped wearing every kind of dress on this planet. Whether they were wearing a hijab or a long dress or a blanket, and women of all ages have been raped, like you saw, even little ones. So nobody is to blame for being raped. Let nobody tell you and convince you that you provoked them. We are not animals. We are not animals. We are human beings with a conscience, with the capacity to control ourselves. Nobody loses and goes wild, I got lost, that is all nonsense. So guilt should not be, no matter what you were dressed in. Fear, damaged goods syndrome, where people say, I am damaged now, finished. So they provoke, they don't care anymore. So they get into all kinds of situations where things things which are dangerous to them start happening because they have lost that sense of self-preservation, which is common with humans. Decreased self-esteem is a very, very big problem. And as we shall see, they are likely to end up in one of those kind of relationships which you wanted me to talk about, the toxic relationship. Now, what do you do after rape? This is important. First, seek safety. Okay? Seek safety. First, call a friend, relative, trusted person, whatever. Now, most important, do not wash or change clothes before going to hospital or going to the police. And before you go to the police, go to the nearest health facility, because it is very important for them to collect evidence and to start you on PEP, emergency contraceptives, and STIs. So before you go to the police, go to the hospital and make sure that you get this physical examination, repair of any damaged tissues, emergency prophylaxis, post-rape trauma counseling, which is a crisis intervention for just that time, then collection of forensic evidence. And that is why you should not wash and why you should not change your clothes, because you might destroy the only evidence that is available to nail the perpetrator. And most perpetrators are not nailed because we don't have that evidence. Then make sure they fill a post-rape care form. That is a form that is allowable in court to be filled by whoever sees you, nurse, psychologist, scans, whatever. Now, then after that, report to police. Preferably choose one where there is a gender desk. In Nairobi, I know there's one in Kileleshwa. I don't know where they are. Is it Kileleshwa or Kilimani? Kilimani. There's, I think, they may not be available in every place, but the hospitals where you go to, the gender-based violence recovery centers, usually know where the gender desk is. But in any case, you need to report to the police, although that is always not, doesn't always have very good positive outcomes. Now, very quickly, so that we still have time for questions. Toxic relationships, you wanted me to talk about. A toxic relationship is characterized by repetitive, mutually destructive, unhealthy patterns in a relationship. And these involve either different combinations or separately of mainly possessiveness, jealousy, dominance, manipulation, and different forms of abuse. Now, one of the things that you need to know is, are you in a toxic relationship, or is your friend in a toxic relationship? And there are some several pointers that can help you. One, you have an intuition. Your intuition tells you, your friends or even family friends tell you something is wrong in that relationship. You don't believe it and you try very much to defend it. But even you, if you listen to that small voice inside yourself, before you shake it off, tells you there's something not right. When you approach your partner about something negative you've observed, he or she turns it against you, calls you paranoid, says, in fact, you're projecting. You know, that is you who is like that, you know. Social isolation, the person manipulates, cuts you off from friends and relatives, tells you they're talking about us, they don't like us, even your family doesn't like me. And in the end, the only support system that you have is your relationship. You lose all your friends. You develop certain maladaptive behaviors to cope. You find yourself, you're drinking more, eating more, sleeping more, not going to class. You start losing yourself. You're afraid to voice your opinion. You have a low self-esteem, and you don't think you're good enough. And this partner keeps on telling you how you're not good enough. Your partner treats you bad and then good. And this is a common strategy, what they call intermittent reinforcement. That means you don't know when they are going to be good. And when they are good, they are so good, they put you up there. You're the king or you're the queen if it's a woman. And then they will, after that, they will treat you really bad. And then suddenly, without warning, without you expecting it, suddenly they're taking you out, they're buying you presents, and it keeps on repeating itself. It's called intermittent reinforcement that keeps you there begging because you are almost addicted to these good feelings and you don't know when they're going to come and you don't know what it is you need to do to get them. So you're more like that puppy sitting there, always looking up, hoping that something will drop from the table because sometimes it does drop from the table. The other one is the clinginess. You're clingy, needy, dependent on your partner. You can't live without them. At least that's what you tell them yourself, the kind of thing, can't live without you, when they make you feel like, and sometimes they might go away for some time, they don't call you just to make you get that hang of how important they are. You're tired, you're drained most of the times when you're with them. These are some of the things that you want to look out for and look out for your friend. But remember, when you talk to your friend about being in a toxic relationship, you have to be very, very careful because they are going to cut you off sometimes. So you have to have a strategy of going about it. And usually they will also go and tell the friend, whoever it is, and the friend will tell them, see, I told you, they're jealous. This person is just jealous of us, So these are pointers. Now, intimate partner violence usually occurs within toxic relationship, and it follows a cycle, okay? First, there's let's start with how it builds up, okay? You're in a relationship, it is new. Tension is building. It's the guy or the woman starts criticizing you, they're yelling at you, they start swearing, they start coercion, and then you can see anger is building, they are more irritated with you, and that explodes. And when that explodes, you get violence, physical, you get hit, you get emotionally abused, you get sexually abused, you get threatened, and then a lot of times, because you are a sensible person, you withdraw. You're angry, you withdraw, you cry, you say, I'm not seeing you again. And that's when you start getting the SMSs, apologies, I love you so much. You get these presents, you get flowers, cakes, sweets, whatever. It's called the honeymoon period, okay? The guy says, I'll never do that again. Guys are good at that. I hear they go on their knees and cry. Crocodile tears flow. And the women forgive him. And it can happen both ways. It can also be a woman doing this to you, okay? And don't leave me, I'll never do that again, and so on. And then the honeymoon period doesn't last very long before, again, small things start to appear, criticism. It just builds up. And in a relationship that is sort of like permanent, like in a marriage, this can become very, very nasty. And when these people even appear with injuries, in casualties and whatever, they still refuse to be parted from this person because they are dependent on them. They have that dependence, that neediness, that belief, that low self-esteem that says, nobody will take me if this one leaves me. This is the only person for me. Who else can take me? And he apologized. You're there with a broken leg, and you're saying, I forgive him. Do you remember that story? I hope you remember. What was it? Was it a woman who was removed eyes? And then she'd say, I forgive him, he has apologized, and so on. So thank you very much. That is the end of my presentation. Now I can listen to your questions. I hope I integrated some of the questions that were sent. I want to say that I didn't tailor this particularly for COVID because sexual violence, gender-based violence has been with us, is with us. The only thing that may have changed is that because of families being locked up together so much, there has been an increase in domestic violence. that being enclosed with each other and being, it seems to have provoked, and that irritation of not being able to get, and the fears seems to have increased. The domestic violence seems to have been on the increase. So now I'm ready to take any questions, either verbally or in the chat, but I'll leave it to the our, who was it? Was it Mombi or was it who was it?
Yes, that's me.
Okay.
Thank you so much, Prof.
Okay.
Thank you so much for that presentation. It was very well articulated, and the problem that is gender-based violence in our society was discussed very well. And thank you for also highlighting that gender-based violence is not the problem of the victim, but of the perpetrator. I do have a few questions that were put forward through the SCOMER platforms, and I hope it's okay for us to go on.
Yes.
Okay, so one of the questions that was put forward was about, is there any evidence to show that there is likelihood of abuse victims becoming?
Ooh, she has frozen. Does anybody else have that question? Because Mombi has disappeared. Is there any, or is it written here? Oh, sure. All right. Yes, you can have access to the slides. I didn't get the question. Does anybody know what that question is that Mombi wanted to say? Is there any evidence that? I know I had been sent some question. Let me see. Or can we listen to another question while we are waiting for Mombi to come back from the land of lost internet? Let me see whether I had questions. Harassment as forms. Of course, workplace implications, men's mental health. Is there evidence? I found the question. It says, is there evidence, if any, that shows likelihood of abuse victim becoming abusers? Yes, there is. And this is very particular about males. That male children who have been raped as children or sexually abused are also likely to become abusers. There seems to be a lot of evidence for that. Girls who have been abused are also likely to enter into abusive relationships. And that is why I also put them one of the risk factors of a toxic relationship. Women who have been sexually abused are also like a lot in our country. A lot of women who go into prostitution because of resources, economic resources. But in countries where there are enough resources, social welfare that wouldn't need, we find that sexual abuse in childhood is one of the reasons why women go into prostitution. It is the damaged goods syndrome kind of issue. Can women who have been raped become rapists? There's not very much evidence on women as perpetrators of rape. Most of the men who are raped by other men. So I hope that answers that question. Mombi, are you back?
Yes, I'm back. Thank you. I'm sorry. I think I have a problem with my internet.
It's okay. I just read your question because Benjamin had sent me some of the questions. So what other question haven't I addressed?
We can talk about what support is there for gender-based violence victims.
Yeah. Okay. What we have, like I said, something like almost 15, 20 years ago now, there was a very strong movement that was after the Sexual Offences Act, and there were all these working groups. And the concept was to establish what we call one-stop centers, the gender-based violence recovery centers at all levels in the hospitals and within the health centers. Some of them have been functional, some have not been very functional. And the one-stop center was like a facility where you could go for all these services, where the gynecologist is there, the surgeon can be called, pediatrician can be called, you have psychiatrists or mental health providers, psychology counselors, and you would get PEP in the same place. They were, the collection of evidence would be done at the same place, and people are even trained for this, like in Kenyatta, I remember. And so that this movement from one place, first of all, and of course the reception, even in casualty, and even now, if you are a survivor of sexual violence, you don't have to go to casualty. You can go straight to the Department of Mental Health, where they have the GBVRC Center in Kenyatta, and you'll be attended to. For the youth, it's a possibility of going straight to the youth center. And even in casualty, you don't have to queue. There is a gender desk. There is a special gender desk to keep women from moving from place to place. And at the same time, you can, with this concept, the legal people, the lawyers would come, and they had feeder. There was a COVAL for the children. COVAL, Coalition Against Violence Against Women. And there is CREDO, which was dealing with children. They were all legal representatives, free. And at the same time, the even police, like at the police station from the gender desk, could be involved. So the idea was to support people at all, with women from moving. But it has not grown as expected. Some of these centers are still there, they are functional, but not all of them. So that is more or less what there is. But at least a lot of education has gone into it. There was a lot of education that went into the police services and to setting up of what they call the gender desk, because a lot of problems have been with the handling of rape survivors when they go to the police station has been very, very bad. So that is more or less, but let me tell you, what can you get yourselves? Like I said, if you are a student or you have a friend and they tell you, please follow those instructions, call your friend, tell them, this is what to do. You must get PEP within 72 hours. So it is very important. Emergency contraceptive and the treatment, and most important, just report. I know it takes a lot of courage, but if you don't report, the perpetrator will continue raping other women. So I don't know whether that tells you something.
Yes, that's definitely does answer our question. My next question is about the fact that most of the gender-based violence is against women. Is there any role of men's mental health in its influence on gender-based violence?
Yes, when we talk about community education, it must include the men, because like you say, most of the perpetrators are males. And one of them is, sorry about that, it's my clock.
Yeah, it's okay. Just go ahead.
It's about the socialization of boys, okay? When we socialize our boys to be more caring, and you're going to be parents, so you have a role. You're going to be mothers of boys. Socialize them to be respectful to women, to you, as their mother, and not just you, to all women, to be respectful, to be caring. It may make a lot of difference. When you socialize men to be tough and aggressive, okay, you're
Yes.
actually socializing them to be abusers of women, because you're telling them the only way to show up your masculinity as a man is to oppress a woman, is to act violently against women. It is to act as if you don't care, you know, and that is a big problem. And the men also hurt from this kind of socialization. They are, in that sense, victims of a society that expects them to be rude and aggressive and uncaring and abusive, to beat their wives, and in public, to drink too much. You know, these are all problems. So there's a lot to be said. There's a lot. And parents are mothers and fathers, and they must protect their children. And I find that very, very important. When you have children, girls or boys, you need to protect them. You need to be able to communicate with them so that you know what's going on in their lives.
Thank you.
Let me just mention that alcohol, remember, perpetrators, like in the state in college, they have found that 63% of the perpetrators were using alcohol. So can we make a difference if we are controlling the use of alcohol, or promoting sensible guidelines? If your partner, if your friend, your boyfriend is drinking too much, if your boyfriend gets drunk and starts hitting you and pushing you around, you're not doing him a favor by saying he was only drunk. If you want to do him a favor, is to tell him, look, seek help or we're done. You know, because it's not going to stop there. So don't cheat yourself. It's only when he is drunk. He's a very good boy, except when he is drunk. You're cheating yourself. That good boy will beat you up, rape you, and he will only do it because he was drunk. And you'll be the injured party. Any other question?
Yes, there are a few questions that have been sent through the online platform here.
Yeah.
Rodney Onguka asks, okay, he says that rape is just another power play. Yeah. I'm wondering what goes on a rapist's mind. Do they have a particular predictable pattern of behavior?
Yeah, that's a good question, because sometimes people think that it is power play. There is one type of, I just want to say this, you know, people who are mentally ill are not more likely to rape you than people who are not mentally ill. There might be a predisposition when you include alcohol dependency and alcohol use and drug addiction in mental health problems, which it is, you know. As we've said, the abuse of alcohol is also a mental disorder. People who are manic are likely to be disinhibited. They also have physiologically, biologically hypersexual, so they may, but they're not known to be particularly more likely than, so sometimes it's very, very difficult to tell. There's one type of personality, some types of personality disorders, and one of them is this antisocial personality disorder, the aggressive rapist. This is the violent rapist who will rape and strangle you, and lock you up in his house, rape you, kill you, bury you, get another one. You know, you've had those stories, terrible things. There's also the person who has one of those personality disorders where they have problems making social interactions and social relationships. And that can be a problem because they lack very important social skills. However, most of the times, that person is a person who you cannot tell from others. But it is not often in these relationships, it's not often that it happens just like sporadically like that. In a relationship, there are always signs. There's that pushiness, there's that attempt to push boundaries, there's that possessiveness, and so sometimes there may be clues that you can pick on that will tell you that this is not going well. Yeah, what is the problem here? Yeah, toxic. Yeah.
Okay, thank you for that. Wendy Oguto asks, what advice would you give to a parent whose child has gone through abuse? What behavior changes will they notice, especially in younger kids?
Yeah, depends on the age of the child and the cognitive developmental phase. Because children may not always be able to explain what happened. They may not be able to verbalize, but some of the things is the child changes. They're characterized by a lot of irritability, crying a lot, nightmares, lots of sleep disturbances. Some children the earlier ones, they develop, if they were dry, they develop enuresis again, encoparesis. Child is afraid, very, very afraid of getting out of the house or afraid of being with adult people. They may show fear of a certain gender type, like male. They may be afraid of going to school. The eating habits change. So there are important changes that can tell you that something is happening. Some of them enact the rape. You may find the child is suddenly very, very obsessed in putting objects in their own genitals or in the genitals of other children or in the anus of other children or in their toys, or so there are certain clues. But so my advice would be for such a parent to seek help to child psychologist, child counselor, psychiatrist. It's really very, very important. And to listen to your children. Tell them to listen to their children, because if they listen, they may hear the story, what so and so did and what the other did not do and what happened. And the other is to not put your children at risk of getting raped. Most children are raped by people in their circle of friends. Not to leave children in the company of males, adult males, or even adolescent males. Not to leave children under employees who are of the other, watchmen, hanging around with watchmen. I see that kind of behavior where people are sending their children, girls who are 10, 11, 10, to the shops towards dawn in the kiosks, going to buy sijui mafuta, sijui what, where children are allowed to go to school taking shortcuts alone through wooded and places, through neighborhoods where people know that there are people who are abusing alcohol and drugs. So it's that thing about being noticing, observant, and being aware that these things happen, and you need to protect. Children need to be protected. They have to be told not to accept gifts and presents or to shake hands of strangers, okay? And to run for it and scream.
Thank you for that. We do have a last question from Benjamin Maseretti. He asks, is there a way to identify victims of gender-based violence, especially when they have no physical tellers or unwilling to share?
Well, it depends, Benjamin. It depends, like I said, with children. You can. If they are your friends and they are not telling, it might be difficult, but you may notice that they are more withdrawn than they have been before. They are more withdrawn, they have more secret lives. So with adults, sometimes you can't tell, but sometimes if you're really observant, you can see that some kind of trauma has happened. The question is, what type of trauma? You see? Because even other forms of trauma may also have similar characteristics of withdrawal, depression. Suddenly somebody is abusing substances that they were not abusing before. Girl is drinking too much. Why is she suddenly drinking too much? You might want to ask your friends, what is happening? Why are you no longer, the person who I knew? So, but on the other hand, if these are people who are coming to you as doctors, they may come to you with different complaints. Like in psychiatry, sometimes we get people coming even 10 years later, but the complaints they are complaining about is the complaints of lower abdominal pain, pain on sexual intercourse, the infertility, even a lot of things. And then that is why part of our mental state examination always includes asking about a sexual abuse, whether there's any, has there been. When you ask about the sexual history of the patient, now I'm talking to Benjamin as if you're the doctor. For us in psychiatry, we always ask about the sexual history, and we always ask about sexual, we ask about your sexual behavior, we ask about that, and then we say, have you ever had an experience where somebody forced you to have sex without your consent, and so on. And sometimes it turns out, yes, 10 years ago, and the person is still trying to seek help. I hope that answers.
Yeah, definitely it does. Do you have some more time? We have 2 more questions from. Okay, thank you. So Shagari Jones asks, how do we take care of the perpetrator? Do they have a right to health as well? For example, assuming that the survivor is seroreactive and the perpetrator is seronegative, do we offer PEP to them, PEP to them?
Everybody has a right to healthcare, okay? But a lot of time, remember, this is a rape case. The perpetrator may not come unless the perpetrator has been caught and was brought. And of course, if he was brought, he is in the hands of the police, but you give him PEP the same way we give prisoners and people from remand, yes. The question as to whether you can give psychological support to perpetrators so that they get better. First, you have to remember that these are criminals. They belong in the courts and in prisons. And if it's a person with a clearly definable mental health illness, that should be treated. Any illness, and it's just like you say, supposing a thief is brought to you after he has been shot by the police and has a bullet, do you remove it? Of course you remove it as a doctor, yeah. So, but I just want to tell you that rapists, pedophiles are very, very resistant to treatment. A lot of countries have tried spending a lot of money on rapists, and they have not been able to show much for it. They tend to repeat themselves. And so if you might have read a bit about what people do in the UK or in other Western countries, is they get to be on a register of rapists, and sometimes they are released from prison with a tracker. particularly pedophiles, to make sure that anytime they go in an area near children, the thing peeps in the police station and they pick them up. So if you have money to spend, don't invest it in rapists. Invest it in treating survivors and in informing communities and putting preventive measures so that rape does not occur, and treat little boys who are victims of rape or survivors of rape. But it's a difficult question as to whether they owe psychological support. Group therapy has been tried, particularly in prisons, but the success rate is not very good. Yeah.
Okay, thank you for that. There's someone who wants to ask a question verbally. I think they can
ask. They can ask. Yeah.
So, hi, Prof.
Yes.
Can you hear me?
Yes, I can hear.
Okay. I wanted to ask a question. There's something I read on, I think it was a blog or something, where this girl was saying she was 16 and she had a boyfriend who was 17. So this boyfriend ended up like coercing her into having sex with him. So she was saying that the comment down there was that if most ladies were to look back at how they lost their virginity, they would come to the conclusion that they were raped. So so I've been actually thinking about it, and I'm like, does that statement make sense? Is it a valid point or something?
There seems to be studies which indicate, I'm not calling it rape, coercion. Remember? There's a difference between coercion and rape. And coercion is also a form of sexual violence. Okay?
Okay.
So that you consent, she consented, but not because she had planned and she was willing and she was an ikna, but because he said, if you don't do it with me, you don't love me. Or if you don't do it, I'm going to burst and die. You can see what you're doing to me. It's all your fault. Or with some of the girls, you know, it could be a financial. If you don't do it for me, you remember that phone I wanted to buy you, I will not. You know, that's coercion, pushing, whether it is psychological or even physical. Okay. So that she says yes, but it is under coercion. WHO puts coercion under sexual violence. However, coercion may not be a crime under the Sexual Offences Act in our country unless the person, like your friend here at the age of 16, or not your friend, your blog friend, or the blogger, because she was a minor. And that creates a big problem because even the boy was a minor. And this is where the problems come in, because an offense has been committed by a minor against a minor. It's a very tricky situation.
Instead of it being a topic, it became more real. If I make sense, yeah.
Yeah, it does.
If that makes sense, yes. Thank you very much.
Okay, thank you very much. Who do I send the slides to?
Okay, so you can send the slides to Benjamin.
Benjamin, okay.
Yeah.
Okay.
Thank you so much.
Thank you. And have a nice evening. Okay, bye. Bye-bye.
Okay, sure. Thanks, everyone. Goodbye.